people do tend to fill in over time after lunch. I'm Brandon Gill, and it is my tremendous privilege to introduce Professor Alexandru Soceanu from Munich, University of Applied Sciences in Germany, who will be presenting on managing the interoperability and privacy of eHealth systems as an interdisciplinary challenge. Now, he asked me to abbreviate his extensive biography. Professor Soceanu is in the Department of Computer Science and Mathematics, as I mentioned, in Munich University of Applied Sciences in Germany. He earned his PhD from the Technical University of Munich, one of Germany's elite universities, and his thesis was scheduling algorithms for distributed computer networks. He's got extensive teaching experience, over 25 years, and has done a whole bunch of very interesting things which are on the second page, which he asked me to omit. So I will introduce Professor Soceanu, and thank you so much for joining us.
Thank you for the presentation. And I have to start telling you that I have some disadvantages in presenting here in the United States. First of all, I was planned to present after the lunch. That is one of the most difficult parts of the presentation. Secondly, I cannot speak that fast like the Americans are speaking, so I cannot bring you the whole information which I was thinking to bring, but part of it. And in order to keep your attention, I will start as much as possible to use some pictograms and some analogies so that you can get my point. And while Dr. Najib, he told me Najib. So Dr. Najib invited me to give a speech on subject out of my type of research, which has to do with an interdisciplinary activities. It came in my mind came this picture. And I was thinking that we start at that point. I believe that you know what I am talking about, and you know about the guy who in 1400 succeeded to be what? To be all-in-one player. He was an expert on 11 different fields. He was a painter, a scientist, mathematician, engineer, inventor, also an interdisciplinary guy in himself. Okay, good. He made quite a lot of invention, like we know. So he invented the parachute, he invented the panzer, like we say, so the tanks, he invented the helicopter, and also the proportions of man. This picture is very known under the name Proportion of Man is Vitruvian Man. Okay, good. Let's see what is today. Well, today is the day of awesome. I am sorry, I don't know how to pronounce it, but okay, no one is perfect, but everyone can be awesome. So let's say that we start at that point. Okay, that is my agenda. What do I intend to present you? But today's, because I consider that one of the typical interdisciplinary activity or work is on the eHealth projects or healthcare projects. There are a lot of stakeholders involved into it. And because I had the opportunity to work on it, then I intend to present you some parts of it. So I will go through the enormous healthcare challenges which we have today, and we see a little bit what kind of solutions can we approach. And one of it is to introduce as much as possible eHealth, electronic health, which help a lot of healthcare. And of course, I would like to talk about the interoperability, because in the eHealth there are so many stakeholders who are involving in doing the healthcare or improving the healthcare. So the interoperability is one of the key factors. Then I will talk about a little bit about the privacy protection of the patient's data. And at the end, because the European Commission is aware of the fact that we need help for increasing this kind of direction of e-health, they have quite a lot of funding project on that interdisciplinary project. And I have at the end 2 examples. One of it is in education, the other one is on research. The first one goes to an Erasmus intensive program on healthcare support using IT. This is a project supported also by the European Commission, and I have one on research, remote monitoring control for wearable artificial kidney. Okay, I am talking more or less from the European community point of view. For all the Americans who might not know, we are 28 states together. You see here, and all of them are contributing to Brussels to give money in order to support some project, and we are entitled to have, or let's say to apply for projects if some of these countries are within the project. By the way, a European project has to have at least 3 countries involved into it. Okay, so what is interdisciplinarity? Bringing together distinctive components of 2 or more disciplines. Of course, then in the last time, through this kind of evolution, we came up to different type of disciplines, which you may see in different universities where we are. And we speak today about medical informatics. We have in German quite a lot of universities offering this kind of curricula, bioinformatics, mechatronics. And in our days, in order to be successful for getting funding for a project, you have to prove that you have interdisciplinary. And of course, the underlying promise of a high quality interdisciplinary work is the partners have a very strong disciplinary identity. So not like Leonardo, who knows everything. So we create groups who might know everything because everybody knows a lot of within one thing. And let's look a little bit of the health care situation. We have the patient here, and many others are contributing to his care. That means we have physicians who should contribute, we have pharmas, we have chemistries, we have, of course, medical type of devices which are applied, we have insurance, we have government, and all the others are trying to get us better. And which are the reasons why we need eHealth? Because the community, as well as all over the world, we recognize some of these challenges. Growing number of patients, that is one of it. Aging population, everybody is aware of that. Then rapid increase of hospital costs and cost of the care personnel, which fails in many countries. And then we have shortage skilled healthcare labor resources. We do have increasing complexity in diagnostic procedures if we think of kind of lab necessaries to do in order to decide of a diagnostic. And achieving medical objectives are also necessary. We expect to increase a patient's quality of life and not vice versa. Okay, and the European Commission tried to define that for us what is the definition of eHealth? Tools and services using information and communication technologies, improving prevention, diagnosis, treatment, monitoring. And, of course, including what? Information and data sharing between the patients and healthcare providers, between the hospitals, and between the health professionals and health information networks. And which are the goals of the European community concerning eHealth? Improve citizen health, then increase healthcare quality and access by making eHealth part of the health policy, and make eHealth tools more effective like they are today. Okay, with that in mind, we move to the idea that we have to build networks in order to reach this kind of goals. And governments are helping in including or indicating some action plans and in concerning of eHealth systems. And we do have one in this, Europe, which is called the Access Plan of eHealth Communication, eHealth making eHealth better for European. And of course, you have one in the States, which is very known under the name HITECH, introduced by Obama, am I right, in 2009. And there are quite a lot of application into the direction. Okay, so what do we talk about when we speak about eHealth? As a matter of fact, the literature are using different type of terminology, not all the same, but let me put it together. So eHealth is more or less telehealth and telehealth care. But telehealth is divided in two parts. We speak about telemedicine and we speak about telecare. Telemedicine is e-clinical services, teleconsultation, e-health decision support. On the other hand, we have telecare, which deals with remote patient monitoring, with e-learning and teleeducation, e-clinic care and information services. To all of these are to be added e-marketing, e-business, and so on. So that means telehealth and e-health are more or less two similar terminologies for that. Then, which is a challenge for the industry in that direction of e-health. There are quite a lot of activities which are waiting for being solved, and especially in an innovative way by using multidisciplinary research development. And what is to be done? Complex infrastructure. I will come up to that to give you just a small idea, and you can imagine already that this kind of systems are very complex. And we have to solve the problem of interoperability, because if the system is complex and it becomes more complex, then the interoperability is a key factor. And of course, we have specialized adaptation software for it, and which are the expecting dollars to come out of it. Quite a lot. So in 2010, we had 10 billion to market. In 2011, 12 billion. In 2016, we expect 28 billion, and there will be an annual growth rate of almost 19%. This is what they expect. Okay, so when we speak about the solutions of the telehealth, we speak about two types of solutions. One is technical solution, deployment of complex e-health system, and we speak about financial part of the solution, which means European Community in cooperation with Healthcare Association and standard institutes supporting research and development for this kind of systems. And the result of it is immediate opportunity for interdisciplinary EU researchers and developers. And of course, in order to approach one of this work, you need some strategies. Then the complex tasks need to be analyzed, interpreted, and solved in the interdisciplinary teams. Important basic questions are, which disciplines, we have to know which one are necessary to be included, then with whom and when we are supposed to cooperate, and how can these disciplines work efficiently together. And of course, a very, very important point is when you talk about a complex system where so many interdisciplinary parts compound to find a similar language. And I have the experience that the doctors do not understand the engineers do not understand the biologists do not understand the chemistries, and so on. That is one of the very, very great challenge to solve. And let's see how the solution at the moment looks like, because according to all the literature and the developers, most of them came to the point that that is a structure. We have in the middle what we call it electronic health record, or all the information are concentrated. And then we have different type of services which are supposed to deliver information into that data, let's say that container which is called electronic health record. We have, like an example, admission, transfer, discharge, or order entry, or hospital labs, or radiology, or hospital pharmacies, or community pharmacies, or billing, of course, after you have been in a hospital. And among others, after you have been in the hospital, you are supposed to be monitoring at home and deliver all the information so that in electronic health record everything is in it. And what is that? We define, as a matter of fact, that definition is given by ISO, and is saying that an EHR, that means electronic health record, is a repository of information regarding the health of subject of care in computer processable form. And that aggregates quite a lot of electronic records which are delivered by all the stakeholders to that data, and provides a comprehensive view of the patient health. But if we have so many stakeholders participating, writing information into that container, we speak about interoperability. So, like in that case, you need somebody who is indicating how to move the, how do you call this? The violin, okay. And then we need transfer data according to some standards which are known on both sides. And we speak in that case from level 7, for instance. And all the others are supposed to deliver data in using protocols and application program interfaces which are known here and there. So we come up with a picture like this, where we have, in that case, quite a lot of standard protocols and standard structure into that. And who is delivering us all this information, and what should we follow? So there are some associations which are very known meanwhile, because they are contributing quite a lot for this type of applications. One of it is Continuum Health Alliance. There are more than 300 manufacturers, institutions, and education institutions, research institutions, which are affiliated to that alliance. And we speak about integrating the healthcare enterprise, yes, as well as health level 7, which is around 15 years of development in it, as well as many others around. That's a picture which Continua is transmitting to us, and we supposed to follow while we develop this kind of systems. So they said, in case of personal devices, which may be a thermometer, a pulse oximeter, a weight scale, and so on, then you are supposed to use one of these protocols, like maybe Bluetooth, for instance, ZigBee, or IEEE 10.11.73. And afterwards, the data from that application host device are supposed to be transferred to a care center, and from here to be transported here. All this transport of data are supposed to be standard, and these standards are to be implemented on all sites in order to create the interoperability. Okay, we speak about interoperability, and when we speak about interoperability, we have to think of 3 specific terms. One of it is technical, that means the exchange of information. The other one is semantic, that means the use of this information on the other side. And the process interoperability, that means what I got on one side, I have to be able to use it. That means I have to understand what is in there. Okay, so figures expected in the next year. How do we access all this data now, which we produce on healthcare of a person? We expect that just in 2012, just in one visit of a patient to the hospital, they generated 50 petabytes. So meanwhile, we speak about petabytes. Okay, it's, 1 petabyte is 1,000 terabytes and so on. But if we continue to work digital on everything, we expect more than 2,500 petabytes. So that means we still have also some additional data which are generated by telemedicine, as well as data stored within different structure models. And how do we access this data? That means that is another problem. We speak about interoperability, we speak about the structure, we spoke about the interoperability. Now we have to speak about how do I access it. Of course, we have security, which should be taken care of, protection, as well as privacy protection. But if I look at Jill, I have the impression that I have to, how many minutes do I still have?
You have about 10 more minutes.
10 more minutes. So I will skip. Of course, for security, I would need probably another semester to present the... Okay, for data protection, we speak about authentication and so on. And in case of privacy, there are also some associations which are taking care of rules for applying. And we speak about the OECD, Organization of the Economic Cooperation and Development, who included different type of rules, like for instance, collection limitation, purpose specification, limitation principle, and so on and so forth. So there are a lot of principles to be used in order to be able to protect that. The government is taking care of that, of course, in Europe as well in USA. And they have protection directive, which are supposed to be implemented into the software which is used for accessing data. And the ones who are using that, I guess they know about it. And if we speak about privacy management components, which I promised to say, but Again, so we speak about authentication, we speak about authorization. And I guess one of you spoke about also in case of authorization, you have to have access control decision, which are again made based on different type of rules, which are role-based or attribute-based. Okay, so let me finalize that part saying that because of the tremendous amount of standards which we have today for transmission health data, and because of standard data models of electronic health care, we do have an implementation problem. Existence of these diversity models is not easy to put it all together. That's why we have today quite a lot of systems which are not interoperable with each other. And because of that, we have, I jump over it, we have at the European level some movement, some announcement in order for us to apply for projects which are supported for creating the so-called eHealth European Interoperability Framework. Today, the lack of interoperability is supposed to be supported through a lot of research and a lot of prototype. There are a lot of money involved in it, and I just put it somehow together. We have in Europe for 2 years a program with a budget of 700 million. It's not a lot, but there is somehow. And innovative ICT-based solution for implementing eHealth interoperability. That is one program for 2 years. Then we have another program which is called EU Health Strategy. And concerning eHealth system, we have there another budget for 440 millions. And there is another program which is called AAL. That means Active and Assisted Living Program for Aging Well, another 700 in order to create this kind of system. Okay, so I have now 8 minutes for the case studies. I have one case study which is again an EU support for the students. Now we have a lot of students and they have to be so good that all the companies are waiting for that. And what we did with the support of the European Commission, we put on place in 2014 such a project with 6 universities. It's called Healthcare Support Using Domotics and IT. It is an example of an interdisciplinary group. We had healthcare students, we had robotics students, we had ICT, mechanics, engineering, aeronautics, business informatics, business, and economics. The level of students who came to the project, to the program, was 4th year bachelor and 1st year master. It took place in Helsinki. And they supported us very much because Helsinki has a healthcare informatics curricula. And what the companies, the universities who participated, they were in Finland, Germany, United Kingdom, Netherlands, Austria, and Slovenia. Of course, all of them, they had to speak English. And that was another opportunity for the students. And we had some outcomes. University and students get better insight in the healthcare. Then multidisciplinary project they had to create in order to get ECTS to be acknowledged. It was a 2 weeks program, intensive program. And then for the students, they should be capable of calculating the impact on ICT and domotics. And of course, exchange of knowledge between the students and staff. And some of the projects which they presented, And for instance, Ljubljana, medication reminder using pill detection. Amsterdam, so Netherlands, find my stuff application to support daily life. Yeah, 5 more minutes. University of Birmingham, safe care, privacy and security in video conferences. Then in Helsinki, you recognize the city, I guess, no? Design, no. I know, but design and develop, you had the Finnish 500 years under Ullmann. I mean, you should know. Design and, yeah, design, by the way, in Helsinki, all the streets have 2 names, in Finnish and Swedish. So that design and develop a web application for elderly people, as well as in Austria, they had a generic monitoring application for people with coronary, as monitoring health vital signs in Munich. Now, I have the second for 4 minutes, the second case study, which is research. The idea was to create a prototype for a universal platform for management and remote monitoring control of wearable and portable dialysis devices. We have been put together 12 partners from 6 countries, and under the coordination of the University of Padua in Munich, in Padua, and in the renal treatment dialysis institute in Vicenza. So, for everybody who doesn't know, today dialysis treatment takes care like this. You go to hospital 3 times a week, and you stay here 3 hours to get all your blood cleaned. And that is very difficult for many people living very far away from these kind of centers and so on. What we supposed to do, then Dr. Ronkos and the American Dr. Guras did a prototype at the Vicenza Renal Institute, and you see it here. That means a wearable artificial kidney, which is here. And instead of having 150 liters of water used for cleaning the blood, then you have here just 1 liter. But for that reason, you have to have a special liquid which you are using. And this is working similar with a normal kidney. It does not wash the whole blood like in the case of the hospital. And when you go to that Renal Institute, you see a poster like this saying that they are working multidisciplinary experts. They have biologists, bioengineer, applied physics, machinery development, testing, and so on. That is a poster which you see there. That means that is the only way to manage this. And that is a small diagram, what we proposed. We proposed that this artificial kidney is included into a backpack. And this backpack is supposed to be controlled locally and remotely. That means remotely you have the information into such a portable universal terminal, which can be a smartphone, which is in connection with a remote care center, and they are monitoring permanently what happened here. And then we have all the vital signs connected to that portable universal terminal, which goes to that remote care center. The supervisor here is able to give indication. He has another audio telephone in order to be able to give information, and is possible to do That means if we create, and this is what we started to do, so to create such a system which is operating locally as much as possible and controlled remotely, then the people will have this kind of artificial kidney on them. And here, just to give the whole picture, the stakeholders involved into it, that means you may be here at home doing that, but you, at home, but you can do it also in some other homes, you can do it in satellite clinic, then you send the information to the care center. The care center is connected using all these protocols with some other hospitals, physician's office, and so on. So this picture brings us to the idea that let us talk to Leonardo and ask him if today he will get the question about IT, no problem for me. Medicine, no problem. But act globally. I wonder a bit if Leo could really handle this challenge all by myself. That's it, and that's the reason why Mona was smiling. Thank you.